Hello, and thank you for joining me today. If you have concerns about being pregnant or giving birth during the current COVID pandemic, then this video will give you some evidence-based answers to many of your questions. I'm Colette Wiseman, and I'm a UCLA-trained emergency medicine and internal medicine physician practicing for the last 13 years in Los Angeles. I'm also a clinical lactation counselor and a pregnant mom of 2, soon to be 3. Today I'm going to discuss the issue of COVID and pregnancy, how to stay safe, and what we know about COVID risks during pregnancy to you and your baby. The information I'll give you today is based on the most current American College of Obstetrics and Gynecology and Centers for Disease Control guidelines as of early July 2020. But please remember that guidelines may change periodically as we get new information. I can also provide a customized prenatal session with you if you have further questions specific to your situation. A little background on COVID. As most of us are aware at this point, symptoms include fever, coughing, body aches, fatigue, and a loss of sense of smell. It's mainly transmitted through respiratory particles in the air, but also possibly by touching contaminated objects and then touching your face. Some simple ways that we know of to minimize your risk of getting COVID include social distancing of at least 6 feet even while outside, and minimizing contact with people outside your house as much as possible. Outside is considered safer than inside, but you should still socially distance even if you see people outside. You should also stay away from anyone who has a known sick contact within the last 14 days. Let's talk about the risks to you and your baby if you do have COVID during pregnancy. Most women are most concerned about what the effects could be on their baby. We don't have a lot of data at this point, but the good news is that so far we are not seeing any major effects. But this may change as we collect more data and as we follow babies more long-term after birth to see if there are any concerns. There is a suggestion of some effects on the placenta, but again, nothing that has affected large numbers of babies, and we'll have to wait for some more studies to tell if there is any risk to be concerned about. How about the risk to you as a pregnant woman if you have COVID during pregnancy? Well, we do know that there's an increased risk of ICU admission for pregnant versus non-pregnant women, but no increased risk of death compared to non-pregnant women who have COVID. You are at more risk of getting pneumonia because of physiologic changes in your body during pregnancy. So what can you do to minimize your risk of getting COVID during pregnancy? In addition to the precautions I mentioned before, you can maintain all of your prenatal care appointments to optimize you and your baby's health. This includes telemedicine or in-person consultations with your midwife or your OB/GYN doctor. You should maintain your immune system in as good health as possible by getting plenty of rest, eating a healthy diet, and taking a prenatal vitamin every day. There are some vitamins that studies show can help your immune system, such as vitamin C, vitamin D, and zinc, but you should first discuss with your doctor or midwife if you should supplement these during pregnancy, because it may not be healthy for your baby if you take excessive amounts of these vitamins. Make sure you wear a mask, wash your hands frequently, and maintain physical distancing as much as possible. How can you minimize the risk of you getting COVID during your birthing or delivery time? Well, the requirements will vary between hospitals. How will COVID affect your delivery or birthing time? What to expect in hospitals? The requirements will vary between hospitals, but it does seem that most hospitals are requiring testing of you and your birth partner once you arrive, and most are requesting you continue to wear a mask in the room if other staff members are present, whether or not you test positive for COVID. Most hospitals do allow at least 1, if not 2, support people to be with you in the hospital during your birthing time. But you should ask your doctor or midwife what the requirements are for your particular hospital. How can you minimize the risk of getting COVID while you're in the hospital? Well, first know that hospitals are very safe places and staff are taking all of the precautions necessary to protect you and themselves. However, you should wear a mask when someone else is in your room, and you can plan a short stay in the hospital. If all is going smoothly, 24 hours is a reasonable goal for being discharged from the hospital after an uneventful birth. You may be considering whether a hospital or birthing center or your home is a safer place for you to give birth. Remember, there is a very low risk of actually getting COVID while you're in labor and delivery in a hospital, and the hospital remains the recommended delivery location, especially if this is your first pregnancy or if there have been any complications. Only you and your doctor and midwife can discuss the risks and benefits of a hospital versus a birthing center or home delivery for you. I would be happy to discuss any of these concerns more with you in a one-to-one session in order to address your unique situation and your personal concerns about managing your prenatal COVID risk. Congratulations on your pregnancy, and I wish you and your family the best.